Disorders of the liver. Amebic liver abscess. Amebic liver abscess is a collection of typically brownish colored fluid in the liver, occurring often as a single mass in the right lobe, and a complication of intestinal infection with Entamoeba histolytica. Lung, heart, and brain infections are uncommon sequelae. Occasionally, pyogenic abscesses may have a similar clinical presentation. The treatment of amebic abscesses should be initiated with a tissue agent active against the trophozoite form, followed by a luminal agent to eliminate intraluminal cysts. Cause: Entamoeba histolytica. Symptoms include fever, malaise, sweat, cough, hiccups, anorexia, weight loss, jaundice, which is uncommon, and right upper abdominal pain referable to the epigastrum, right chest or right shoulder, and concurrent diarrhea. This usually occurs in less than 1/3 of patients. So the signs that are usually elicited include large tender liver, tenderness or bulging at the right intercostal spaces, jaundice, dullness to percussion on the right lower chest zones with basal crepitations, amebic empyema, flowing extension into the chest cavity, and peritonitis, which is uncommon. Investigations include abdominal ultrasound, chest x-ray, FBC, that's full blood count, ESR, that is erythrocyte sedimentation rate, stool examination, abdominal CT scan, and serology as for amebic antibodies. So the treatment objectives are to eradicate Entamoeba histolytica infection, to prevent further destruction of liver tissue, to prevent further complications, for example, rupture of abscess into pleural, pericardial, or peritoneal space. Non-pharmacological treatment. Therapeutic aspiration may be required in patients with poor response to therapy. Pharmacological treatment. So the first line treatment, you give metronidazole oral in adults 800 milligrams 8 hourly for 10 days. That's the tissue agent. And in children, 50 milligrams per kilogram body weight 8 hourly for 10 days. And then you give diloxanide furoate oral in adults 500 milligrams 8 hourly for 10 days. That's the luminal agent. And in children, 6 to 8 milligrams per kilogram 8 hourly for 10 days. The second line treatment, you give tinidazole oral in adults 2 grams once daily for 5 days. That's a tissue agent. And in children of age more than 3 years, you give 50 milligrams per kilogram with a maximum dosage of 2 grams once daily for 5 days. And then you give paromomycin oral in adults 8 to 10 milligrams per kilogram 8 hourly for 7 days. That's a luminal agent. And in children, 8 to 10 milligrams per kilogram 8 hourly for 7 days too. The referral criteria: patients with abscesses that are large or not responding to treatment will need to be referred to a specialist.